learning objectives, our goal is to recognize where risk-based decision-making fits into the clinical quality system. Because again, it is about this concept of targeting specific data. But really our end goal in everything we do is to improve quality. Let's just be smarter in order to support that quality, in order to support our varying types of trials and timelines. Then our second objective is to identify risks for a project related to monitoring in terms of how do we define what those risks are, what are our thresholds or our triggers for taking action, because we have to define those if we know when things should change or when something should be escalated. Identify components to include in building the project profile risk score. Again, a little bit of a vague concept moving into it because it isn't very clearly defined in the guidance document from the FDA or even in the guidance paper that came out from the European Medicines Agency. But again, the concept is that we need to know when a risk is likely to occur versus unlikely, and then also what would the impact be? Because again, that really helps us know how quickly we need to intervene and how resource intensive our intervention needs to be. Then finally, apply risk factors to various study decisions, such as the monitoring plan, site assignments, and frequency. But one of the documents that we are providing is an update on their management tools for site selection. So it's one of the handouts that was sent to you on good clinical practice inspections. So the FDA is very aware of sort of the concern that we have of, well, if we don't look at 100% of the data and they go in to inspect and they find something significantly wrong that we didn't catch, how much are we going to be penalized for that? And the FDA inspectors that I've attended sessions for or some of the online forums that I've reviewed with FDA just again really suggest that if we have a well-defined risk-based plan in writing, our monitoring is very clear, our monitoring plan is very clear, our rationale for how we approached risk-based monitoring is well documented. If we truly adhered to our plan, if we had escalation procedures in place for identified nonconformities or problems, that we had tools in place to recognize when something was out of range or when there was a problem. I don't want to say out of range per se meaning one value, but a trend that's being seen at the site. If we have ways to look at that electronically or remotely and manage that, and we do all of those things and something still goes awry, again, a lot of the responsibility is also now being switched to the site. So while as a sponsor we could be held accountable somewhat, again, if our systems are robust and we take action to correct or to ensure that a site corrects their behavior, and we do things to prevent future reoccurrence of problems, that generally meets the FDA's expectations. So their scrutiny isn't really going to change from what they currently do in their audits or inspections. So they still expect sponsors to have good plans. It's just now, even though we're not looking at 100% of the data, we probably need to focus more on what is our escalation process for when there are problems. How quickly can we identify them and intervene? And then in that case, maybe changing back to 100% monitoring to demonstrate that we are very hands-on when needed. So again, that's one of the challenges we're going to face, but sort of the short message there is the FDA's expectation is we have well-written plans that justify our rationale for our approach. And that's really what it comes down to. And then this document I provided here just demonstrates, again, how they're going to start selecting their sites, especially in this risk-based model. Again, what are they going to be looking at? And one of the things we see in terms of risk itself is the pivotal status of a trial, the design type, the geography of the trial, are just a few of the factors right there that do contribute to our decision on whether or not to take a risk-based approach. So that's also going to be part of their decision when they actually select the site to inspect or when they actually focus on